I've been thinking a lot lately about our healthcare system, of course, and what we could probably do to get Medicare for all. There's a lot of things out there right now. Everybody. I'm actually part of the PDA, which is an organization that strives for Medicare for all, along with the Green New Deal. But getting it through simple legislation is not likely going to be enough because you have the Republican Party and other small factions out there on their side who would probably try to overturn it through the courts, through future legislation if they could. So I'm thinking it's best to do it constitutionally, have health care through a constitutional amendment. I actually did a segment about that before. I believe it was called the Priorities Amendment. And there is a constitutional argument on a legal basis to be made for Medicare for all, actually. And it has to do with, of course, the Bill of Rights and the fact that the government's responsibility under the Constitution is to preserve, protect, and promote the public welfare. Well, you don't get much more direct than that on the domestic front when it comes to healthcare. Now, they may interpret this, a lot of people in the corporate circles and in mainstream political circles, as the government is in charge of the military and they're protecting us from foreign enemies, and that's what they mean by that. This is just a ruse to keep the profit machine going for the military-industrial complex, because these media companies, these politicians that are bankrolled by companies that make up the military-industrial complex, including Wall Street banks, including the for-profit healthcare industry, including anything to do with institutions that would otherwise be ensuring the public welfare. So there is a constitutional argument here. Now, the government's job, of course, under the Constitution is indeed to uphold the Constitution, to preserve and protect the public welfare, and that doesn't include taking us to illegal and offensive wars, just so a few companies can make a profit. That's actually putting the public in danger. So there's a constitutional argument to be made about ending these wars at the same time. But while you're doing that, you make the case, okay, in order to get Medicare for all and erase the debt, of course, the healthcare debt, you have to basically nationalize the whole healthcare system, all of it. Big pharma, the hospitals, the doctors, everything. And to make sure that there is no room for somebody to come in there and start engaging in predatory practices. And of course, if you have any kind of privatization, the person who owns the means of production through that has a built-in incentive to increase profits, which means wherever is going to maximize profits, they're going to do. And in the case of insurance companies, that means denying care, denying claims to keep your premiums in their pockets to fatten their coffers, as opposed to using part of it to pay for your medical bills. And the other part, of course, is Big Pharma. And there's absolutely no reason to have any medications in this country cost anything, because all our tax money is what pays for the research and development of the drugs in the first place. They don't need to cost anything to distribute to the public, but they do because they're privately owned. And again, the privatization of any sector means the incentive is maximize profits, which means if something costs, say, $1 to make, and the pharmaceutical industry says, okay, well, we're going to charge $1,000 per pill, just because we can, they're going to do it. But if you had a nationalized pharmaceutical industry, it would be, okay, your tax money pays for the research and development just like now, and afterwards the distribution is free at the point of service because your tax money already paid for the damn thing. So that $1 to make, you're not spending an additional $1,000 to satisfy someone else's greed. That's how that would work. And you get the same product, same quality, same everything. So the only people losing out on this are those who would seek to profit from your illness and your suffering and your death even. And the government, in allowing these private companies to pay them off, allowing them to even exist and make profits like this, are indeed neglecting their constitutional duty to preserve, protect, and promote the public well-being. They're actually doing the exact opposite. They're allowing these private profiteers to hold people in the public hostage until they fork over the money that they want. And if they don't, well, they put them into debt, and then they go bankrupt, or they might even, in some cases, go to prison if they can't pay off their debts. It's a sick, twisted, incentive structure that dehumanizes everybody and commoditizes the most sacred thing we have, our own lives. And that goes against the Constitution. The government is neglectful in its constitutional duties. So I think if we really wanted Medicare for all as quickly as possible without having to navigate all the hoops that are in place, the best thing to do would be to take it to the courts, as risky as that might be right now, and say, hey, the government has a responsibility to ensure the public well-being, and that includes guaranteeing health care as a right, because as long as these private for-profit institutions exist on health care, our lives are not our own. They're held hostage, and the government's complicit in this because they're being bribed by these institutions, even though, according to the Supreme Court, money in politics is speech. Understand that what they're doing as a result of that is in fact going against their duties, and every single one of the people engaged in this either needs to reverse course immediately or be given, I think, have lame duck status imposed on them, if that's even possible. I don't think it is. But, people should have health care guaranteed to them as a right with this constitutional argument that Medicare for All actually is the responsibility of the government in the first place. So I just wanted to say that and see if that lands. But I think it's a pretty good argument to make moving forward.